Hi there. Today I'm going to be doing a super detailed eye exam on you. Just going to use my light and I just want to see how your eyes react to the light. So just keep looking at my nose. Good. Very good. Nice. Okay. Does the light feel kind of bright for you? Okay. Very good. Okay. How about if I get it closer? How does the light feel? Is it too bright? Okay. How about on the other side? Okay. Very good. Can you follow my light? Just with your eyes. Good. Very good. Can you tell me when the light enters your vision? But you have to keep looking at my nose. Okay, let's begin. Very good. Okay, tell me when the light leaves your vision and you have to keep looking at my nose. Okay, let's start here. Okay. Good. Mm-hmm. Good. Good. Okay, we're gonna do the same thing, but I have this red light, and I want you to tell me when you see it blink like that through your peripheral vision. So you need to keep looking at my nose. All right, so just tell me when you see that red light. Good. Very good. Okay. Very, very good. You did great there. All right. Now I'm just going to cover one eye. Good. Now look at my hand. All right. Now tell me how many fingers I'm holding up, okay? Good. Very good. Good. Now let's do the other hand, or the other eye with my other hand. Ready? Okay. Good. Now let's do it with both of your eyes, okay? So, let's try here. Ready? Oh. Okay, let's try over here. Okay. Good. Okay, now let's try with the light, okay? So I'm at the light here, and I want you to look at my hand, okay? Okay, ready? Okay, now let's try this side with the light. Ready? Okay, now I just want you to follow my instructions. So I want you to look at my light. Okay, now look at my nose and my finger. Okay, now look at my light. Now my finger. Look at my nose, the light, my nose, my nose, my finger, the light, and my finger, and the light. Look at my nose, my finger. Okay. The light, my finger, and my nose. Very good. I'm just going to take a look at your eyes with this tool here. So just keep your eyes open. I'm just going to get kind of close to you. All right, so just keep your eyes open. Right? Look up for me, please. Okay, now look right. Okay, now I need you to look down, left. Good. Okay, let's look at this eye. Okay. I need you to look up for me. Okay, now look down. Can you look right? And look left. Good. Okay. Now I need you to follow this light quickly. Okay. Very good. Okay. So I just want to test something quickly. So I have this tool that blows air. I'm going to be putting it really close to your eyes, and it's going to blow air in your eye. I just want to see how your eye reacts to it. So you have to keep your eyes open. Don't blink, okay? Just keep it open. Don't blink. Okay, ready? Good. Okay, we're going to do the same thing on this eye. Okay, so don't blink. Good. Let's do it one more time. All right. Keep your eyes open. Don't blink. Good. It's right here again. Keep your eyes open. Don't blink. Perfect. Okay. I am just going to put on some gloves here. I am going to be touching your eyes, just seeing if there's anything going on. So like any bumps, lumps, anything like that. So just relax. Do you feel any pain when I touch your eyes? Okay, interesting. Okay. Very good. Okay, I don't think I need my gloves for anything else. I'm just going to take them off now. I have this light here. It's a little different. Okay, so it's a red light. I want you to follow the red light. Okay, good. Very good. Very good. Very good. Very good. tell me when the red light enters your vision. Good. Great. We're going to keep using the red light, so I'm just going to put this tool over your eyes. Okay. Let me know when you see the red light. So it's covering your eyes, and there's these little dots that can see these red dots, these red lights. So let me know when you see it like that, okay? All right. Good. Okay, let's do the other eye. Perfect. So, this one's a kind of a different test. So, I have this red little screen here, and I have this. So I'm just gonna power it on. Okay, so let me know when you can see the light exit this red screen. Okay. All right, let's begin. Oh. One moment. There you go. Okay, so you want to kind of see like a blue light. All right, let's begin. Okay. Good. Right. All right. Very good. You did perfect. All right. Now, I'm just going to check your vision. I'm going to put this pretty close to your face. All right. So, I just want you to read the letters out to me. Okay. So, let's start with this letter right here. Good. Good. Mm-hmm. Okay. Now that we did those, I'm just going to cover your eye, and I want you to read the smallest letter that you can, the smallest row that you can, okay? All right. So here you go. All right. Yep, go ahead. Perfect. Okay, let's do the other side. Right. this one's just a bit blurrier. Interesting. Okay, so that one's a little bit harder to read. Yeah, that's pretty consistent with what your prescription was before. So, pretty normal that that's happening. Okay, let's see. I'm just going to take this measuring tool and I want to measure your eyes so we can see. Let's see. It's like, oh, kind of a ruler. Like that. So I'm just gonna kind of see where your eyes are at so we can just try a prescription of glasses to see if that kind of helps when you're reading the letters to me. So I'm gonna measure your PD quickly just to make sure we get the right glasses for you. Just want to double check that you still have the correct prescription. I have some glasses for you. Let's put them on. I'm going to cover your eyes and I want you to read the smallest line you can again. Okay? One moment. Let's do this eye first. Okay. All right. Read the smallest line. Very good. Same thing with this eye. Just read the smallest line. Okay, so it does look better. Very good. Let's read the smallest line. Perfect. Okay, so it looks like your prescription stayed the same. So nothing to worry about there, but I need you to keep those glasses on. We're going to do a color deficiency test. So, what is the number in the circle? Here, 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 and 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 here. Okay, now I want you to trace your finger all the way across from X to the other X, okay? Alright, let's begin. So start here. Good. take off those glasses for you. Great. Okay. So those glasses felt pretty good, right? Yeah. So I'm assuming your prescription is the same. I'm just going to end this examination, just testing your sensitivity again. So I'm just going to put some gloves on. Sorry, I should have did this one earlier. So I have this little hammer, and I'm just going to press it against your eyes. You can close your eyes for me. And then I have this tool here. So I'm just going to spray some liquid, just very gentle. Okay. Yeah, it's just like very tiny drops. The other side. Perfect. Okay. Yeah, everything looks good. Let me just wipe off that liquid. Okay. So everything looked really, really good. I didn't see any issues with your eyes. Your prescription stayed the same. Everything looks fantastic. But yeah, that's the end of the eye exam today. Thank you so much for letting me examine you. You're an amazing patient. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, bye-bye. Hi there, you can come take a seat. So you're here for a yearly doctor's appointment, correct? Okay, well, we can get started right away. I'm just going to get your temperature. So this temperature gun goes on your forehead and your cheeks. So just stay still. Good. Now one more time. Okay, good temperature there. I'm just going to check your ears as well. So this is a different temperature gun that goes inside your ears. So just stay still. Okay. Good. Now I'm going to do the other ear. Okay. All right, very good temperature, no concerns there. And let me see, I'm just going to take this otoscope and look in both of your ears quickly. So just stay still. Very good. Let me look at your other ear here. So your ears look good as well. Do you have any concerns going into this appointment? Okay, so just a yearly. Gotcha. I have this measuring tape. I'm just going to measure you. Okay. Very good. So looking at your file, you grew an inch. Now I'm just listen to your heart. Okay. Okay, so I have this here. I'm gonna put this on your heart, and I just want you to breathe normally for me. Very good. Just keep breathing normally. Good. Okay, now I want you to take 3 deep breaths, okay? All right, let's begin. Let's do the first one. Very good. Let's do the second one now. Very good. Now let's do the third one. Perfect. Okay, now I'm just gonna go up behind you with it, okay? Now I want you to breathe normally. I'm gonna be listening to your heart and your lungs now. Okay, keep breathing normally. Okay, now I want you to do 3 deep breaths again, okay? All right, let's do the first one. Okay, very good. Now let's do the second one. Very good. Now let's do the third one. Very good. Okay, so your heart and your lungs sound fantastic. Very good. I'm just going to check your eyes now. Okay, so I'm just replacing the top of this. Okay, just turn it on. Right, just look forward for me. Try not to blink. Good. Same thing. Just look forward and try not to blink. Very good. Okay, I'm going to look back at that first eye. So, can you look up for me? Good. Can you look left? Can you look right? And can you look down? Perfect. Let me look at this eye now. Okay. Can you look up for me? Can you look right? Can you look left? And no. Can you look down? Beautiful. Okay. Now, is the light too bright for you? Is it bothering your eyes at all? Okay. Can you just look at my nose and let me know when the light enters your vision? So we're going to be checking your peripheral vision now. So just tell me when it enters your vision. Good. Mm-hmm. Mm-hmm. Good. Mm-hmm. Okay. Perfect. Now, Just keep looking at my nose. Let me know when the light leaves your vision, okay? Good. 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 Very good. So I have this red light here. So I'm gonna put it around your vision like this. I want you to tell me if it's up, down, left, or right. Okay. Need to look at my nose. All right. Perfect. All right. I'm going to be covering one of your eyes, and I want you to read the smallest line that you can read. Okay? Very good. All right. Let's do the other eye. Okay. So what is the smallest line you can read? Okay, very good. Now we're going to do it with both of your eyes. Okay. Can you read this line for me? Very good. Can you read this line? Good. Now we're going to really try to read that bottom line, okay? Just do your best. Okay, good try. Can you tell me the two colors here? Good. Okay, I'm just going to take this paper. So right here, it's a measurement of your pupils. So I'm just going to compare your pupils to this. So just open your eyes wide. I'm going to see which one matches. Okay. Just want to measure your pupils with this. Good. Okay. We're going to do one more thing with your pupils. I'm just going to be measuring your pupils. Okay. All right. Okay. Very good. Just measuring the distance between your pupils. Okay, so now I'm going to cover your eye again. Can you see my hand here? Good. I want you to tell me how many fingers I'm holding up. Perfect. Okay, how many fingers I'm holding up. Good. Same thing here, covering your eye. I want you to tell me when you see the red light blink. Good. Now let's do this other eye. Same thing. Tell me when the red light blinks. Perfect. We're gonna kind of do that same thing here. So I have this that's going to cover both of your eyes, and there is kind of an opening, just little dots on one eye. And when you see the light, let me know, okay? So we're going to do 2 rounds. One light is going to be super, super bright, and then the other one is going to be kind of tinier. Okay, so we're going to be testing it here, right? Just covering this eye. Let me know when you see the red light. Good. Let's replace this one to the other eye now. Okay, let's begin. Good. Now we're going to be doing the same thing with a light. However, this one's going to be a bit different. It's going to have a beep sound with it. So sometimes when you hear the beep, you'll see the red light. Sometimes you won't. So you have to be very careful, okay? Right, covering your eye. Right, let me know when you see the red light. Yeah, it's very, very small and dull. Very good. Now let's do the other eye. Very good. That one was a bit challenging than the other one. It's a bit more challenging, so you did get one of them wrong, but that's totally okay. All right. Now, what I'm going to do is just test your sensitivity to air with your eyes. So I'm just going to open your eyes. I'm going to blow some air, so just try to relax. Good. Do it one more time. Very good. Other eye now. Try to relax. Good. Perfect. All right, we are all done with your eyes now. Now we're going to be just checking your hearing out. Let's see. So for a lot of this portion, I need you to have your eyes closed. Close your eyes. so I'm going to be making different sounds, and I want you to tell me what side you hear that sound. It's going to sound like that. So it's a little click. All right. So when you hear that sound, let me know what side you hear it on, left or right. All right. Keep your eyes closed. Let's begin. Very good. Okay. Now, same thing. I'm going to be making a beep sound, and I want you to tell me what side you hear the beep. Perfect. Okay. Now I'm going to be whispering some words in your ear, and I want you to tell me what word I'm saying. Okay? I'm going to get closer. Okay. Dreams. Dreamy. Sleepy. Sleeping. Strawberry. Strawberries. Pineapple. Pineapple. Roses. Rose. Scratch. Scratching. Okay. Very, very good. So that was perfect. Okay. Now I have a tuning fork, and you are just going to tell me when the sound stops, okay? All right, let's begin. Very good. Let's do the other side. Perfect. All right. Now I'm going to be making this sound, so I want you to tell me when you hear that sound, okay? Let's begin. Perfect. Okay, I'm going to just touch your ears gently. Let me know if you feel any pain. Very good. Now I'm going to use this hammer. I'm going to press against your ear. I want to see the sensitivity of your ears. Okay. Any pain? Great. Let's do the other ear. Okay. Any pain? Okay, so we are done with your yearly exam. You did fantastic. I didn't see anything that's concerning or anything to worry about. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? I'll see you around. Bye-bye. Hi, welcome in. It seems like you're really late for your appointment, but that's okay because sometimes we have late night appointments where you can close your eyes and relax. So that's what we're going to be doing today. And we are going to be looking at your eyes and your ears and just your overall health today. Okay. So all you need to do is lay down and relax and we'll get started. Alright, what I'm going to do first is just get your temperature. I have this temperature gun that goes on your forehead and I'm just going to do that now. Good. One more time. Okay. Very good. Your temperature is great. I'm just going to double check with this temperature gun that goes in your ear. Alright, just stay still for me. Just wait for the beep. Perfect. Okay. Good temp here. Let me just check your other ear quickly. Okay. Fantastic. Your temperature is great. And now I'm just going to take a look at your face. Like I said, you could just close your eyes. I'm going to be using a light. I'm just going to be touching your face, just observing, seeing if there's any bumps or lumps. Okay. I'm going to be asking you some questions, but if you end up falling asleep, which happens pretty commonly here, if you fall asleep, it's totally okay. We'll just keep asking questions, and if you wake up and you can answer them, that's totally fine. But does it hurt when I touch your face? Okay, that's good. Okay. I'm going to be touching your ears very gently. Let me know if you feel any pain. No pain? Good. Let me try the other one. Any pain? Good. Okay. I'm going to be looking at your eyes now that they're closed. I'm going to see your lash line. Okay. Can you see the light through your closed eyes? Okay. Let me look at the other one. You have really pretty long lashes. Okay. Checking. Can you see on this side the light through your closed eyes? Okay. Now, can you open wide for me? I'm just gonna get this little mirror and check inside your mouth. Okay, just open wide for me. Very good. I'm not seeing any redness in your throat. Your teeth look very good. I'm not seeing any cavities. I'm not seeing plaque. Okay, very good. I'm gonna just take a closer look at your eyes with this tool here. I know your eyes are closed. I just really want to see the skin, your lashes. Looks really good. Now I'm just going to be touching along your neck here. Feels pretty good. Any pain where I'm touching? Okay, good. Okay. Now I'm going to be looking inside your ear with an otoscope. An otoscope is just a tool that I can see inside your ear with. So I'm just replacing the top of my last tool that I was able to see with your eyes. And now I'm putting the otoscope top on. Now I need to get the top of this. Alright, I was able to find one. So I'm just going to put the top on. And I'm just going to put this otoscope in this ear right here. Okay. So just stay still. I'm going to be just checking to make sure everything's good in there for wax buildup or anything that's concerning, any redness. Okay. Alright, let's begin. Let's look at the other ear here. So I did see a little bit of wax buildup, but don't worry, we can get rid of that. I have this tool here. It blows air inside your ear, so we're going to be doing that just to get rid of the initial wax. Let's do the other ear. that softened the wax. Now we're going to go in with a very gentle pick and I'm going to scrape off that earwax. So just relax. Good. Now let's look at the other ear and remove that wax. Perfect. Now let me just go in with the otoscope one more time. Good. Let me check one more time on this side. All right. Both sides look really, really good. I'm just going to do one more blow on each side with this tool. Good. One more time on the other side. Fantastic. I'm just going to do a hearing test now. Let me know when you hear a click sound. Very good. Now, let me know when you hear a beep sound. Okay, perfect. Now I'm going to use a tuning fork that makes that sound. I want you to tell me when the sound stops. Okay, let's begin. Good. 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 Very good. Okay. I'm just going to take this measuring tool here. I'm going to be measuring your ears. So I know your eyes are closed, but it's just like a super clear ruler. Okay, so just relax. Gonna do it with your eyes as well. Good. I'm going to measure your eyes. Just the distance between your eyes. Keep your eyes closed. One moment. Let me see. Got my flashlight here. Just measuring your eyes. Okay, very good. I'm going to take one more measuring tool and measure your face, your ears. Very good. I'm going to be now hitting your face with a hammer just to see how sensitive your face is. So just relax for me. Okay, did that hurt at all? Okay, now let's do the other side. Okay. Perfect. Doesn't seem like you have any issues there. That is it for our exams today. Everything looked really good. You can keep your eyes closed. You can stay here for the night if you want to keep sleeping, if you are asleep. But I just want to say thank you so much for letting me examine you. And I hope you have a lovely rest of your evening. Okay? Alright, I'll see you around. Bye-bye. Hi there. Today we are going to be doing an ear exam on you. Just putting on my gloves. Is there anything that you would like to tell me about your ears? Anything that's concerning you at all? Okay, so it just feels a little clogged in your ears. All right, so we will definitely check it out, see what's going on, maybe even do an ear cleaning. So I'm just going to start by getting your temperature. I have this temperature gun. It's going to go on your forehead. So just stay still. Good. Now I'm going to do both cheeks. Okay. Now. Okay. So your temperature looks good, but we're gonna just double check with a different temperature gun that actually goes in your ears. So just relax. I'm gonna put it in this ear first. Perfect. Okay, good temperature there. Now let me do this ear here. All right, so just relax. All right, good temperature there as well. Not concerned about if you're sick or not, so definitely good there. Now I'm just going to observe the outer of your ears with my pen light. Just relax. I'm going to be touching your ears and just looking at the outer of your ear. Not feeling any issues there, no lumps or bumps, but let me just check this ear here. Okay, that one is good too. Not concerned about anything there. So the outer of your ear feels really good. Let me now look inside your ear with this otoscope. I go inside this ear first and then this ear after. So just stay still and relax, okay? Okay, now let me look at your other ear. All right, so I'm definitely seeing why you feel that your ears are clogged. You have a lot of wax buildup, but don't worry, we will be able to get rid of that today. But first, we're just going to do a hearing test to kind of compare what your hearing was before with your wax buildup to after when we clean it out. Okay? So I am going to get a tuning fork, and I need you to close your eyes. And I want you to tell me when you hear the tuning fork sound stop. Okay? Okay. Now, let's begin. Very good. Now let's do the other ear. Good. Okay, now tell me what ear you hear the tuning fork. Very good. Very good. Good. Oops. Sorry. Very good. Okay, keep your eyes closed. I'm going to make this sound, and I want you to tell me how many times you hear that sound, okay? Great. Let's begin. Okay, how many times was that? Very good. Now let's do it again. Let's begin. Perfect. Now, how many times do you hear it there? Awesome. Okay, so now what we're gonna do, one more test. So I have this little remote that makes a click sound like this. I want you to tell me what ear you hear the sound, okay? All right, let's begin. What ear? Perfect. Okay. So you can open your eyes now. I am now going to remove the earwax from your ears. So I have this pick here, it's super gentle, not sharp at all. So I'm just going to be scraping your ears, trying to remove that earwax. Okay, so if you feel any pain at all, please let me know and we'll stop right away. All right, we're going to start with this ear and move on to the next one after. Okay, I'm going to start right now. Are you feeling any pain? Good. let's look at the other ear and clean it out. Right. Okay, you're not feeling any pain, right? Good, good. Okay, we're able to take out the earwax in both ears. Now I'm going to take my otoscope and look in both sides just to make sure that we didn't irritate your ear. Make sure we got all the earwax out. Just make sure everything's okay. Alright, so I'm going to be looking this ear first. Stay still. Perfect. I'm not seeing any earwax in there. Just a little bit because, you know, earwax is important for your ears. So we didn't remove every single bit, but we definitely got rid of what was making that clogged feeling. Okay, so now I'm going to be looking at your other ear. Just relax for me. Same thing there. Everything looks really good. No redness, irritation. The wax was removed. So, how does it feel now? Do you feel that clog sensation still? Okay, that's great. Okay, I'm just gonna be touching your ears. I'm gonna make sure that you don't feel any pain. Okay, so just relax. close your eyes because we're going to bring out the tuning fork again. And I want you to tell me when the tuning fork sound stops. Okay? All right, let's begin. Very good. Good. Very good. Okay. Now, I want you to tell me what ear you hear the tuning fork. Okay. What ear was that? Good. What ear was that? What ear was that? What ear was that? Perfect. Okay, so now we're moving on with those remote clicks again. So I want you to tell me how many times you hear the click. Okay, sounds like this. Okay, let's begin. All right, very good. Okay, now we're going to use my hands again to make this sound. I want you to tell me what ear you hear this sound. Okay, let's begin. Good. Now tell me how many times you hear this sound. Okay, how many times was that? Perfect. Now let's do it again. How many times was that? Very good. All right, now we have kind of a beep test here. I have this tool that makes that sound. So I want you to tell me when you hear that sound. Okay? Mm-hmm. Very, very good. So lastly, I'm just going to measure your ears just to get some information written down for next year or whenever you come back again. Okay, so I have this measuring tape. So I'm just going to measure your ears quickly. Okay. just going to use this fan to brush your ear just in case there's any earwax that was left over from the cleaning. Just from the outer ear. Very good. Okay. All right, so we are all done with your ear exam today. We were able to examine your hearing, examine inside your ear, and remove everything that was bothering you inside your ears. I'm going to be sending you home with some ear drops that you can put in to stop any irritation that may occur. And you can use that for about 3 days, but if you feel that clogged feeling come back or if you feel any pain at all, please let us know and we'll book an appointment for you right away, okay? All right, but it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? I will see you around. Bye-bye. Hi there, welcome in. So you are here for your glasses appointment, is that correct? Okay, great. So these are new glasses. So you've had glasses before? Okay. So I'm just going to start off by taking a look at your eyes, just making sure that everything is okay. All you have to do is look at my nose right now. Very good. You have very beautiful eyes. Okay. I'm just gonna get a bit closer and I'm going to lift up your eyelids. All you need to do is listen to my instructions, okay? So I need you to look up for me. Okay, good. Now, look down, look left, now look right. Beautiful. Now we're going to do the same thing on the other side. I'm just going to lift up your eyelids. Great. Okay. I want you to look up for me. Good. Look down. Look left. And now look right. Perfect. Okay. Your eyes look good. Nothing concerning there. Okay. So now I'm going to take my other light. I want you to look at my nose and just tell me when you see the light enter your vision. So we're just going to be checking your peripheral vision right now, okay? All right, so just let me know when you see the light. Keep looking at my nose. Good. Very good. Very good. Okay, we're going to do the same thing just with a different color light. Just keep looking at my nose. Whenever you see the light. Good. Okay. Now, can you follow this light? Very good. Just keep following the light. Just keep following the light. Fantastic. You're doing really good. Okay, now we're going to do the same thing, but with this light. So I need you to just follow this light. This one's a little bit brighter. So after we've done all these tests so far, do you feel like the light hurts your eyes at all? Okay, that's good. Very good. Okay, now I want you to just look at the light. Just look at the light. Good. Okay, now I want you to look at my nose. Okay, now look at the light. Okay, look at my finger. Good. My nose. Now my fingers. The light. Look at my nose. The light. My fingers. My nose. The light. My fingers. Good. I'm gonna cover one eye now, and I want you to tell me how many times you see the red light. Okay, let's begin. Okay, how many times? Good. Other eye. How many times? Very good. Okay. So we're going to move on to a couple more tests, and then we'll start with your glasses. So we're just going to do a color blindness test now. I want you to tell me what number you see, and let's begin. What number is that? Good. What number? 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 Okay. What number? What number? Very good. Now I want you to place your finger right here, and I want you to trace the line. Okay? Trace the line. Ready? Okay. Good. Very good. Great. Okay. We are all done with the color deficiency test. You did amazing. No problems there. Okay. Now, I'm just going to cover one of your eyes. All right. Tell me what is the tiniest line you can see. Okay. No, so it looks pretty blurry. Interesting. Okay, let's do the other side. So read the smallest line. Okay, so it's also pretty blurry for you. Interesting. How about when we don't cover your eye? So I have this here, and I want you to read this letter. Good. This one. Perfect. Mm-hmm. Good. Oops, sorry. Good. Okay, so these two are going to be pretty tough, okay? Take your time, all right? Good, now let's do this last line. This one's going to be tough, okay? Now I'm going to be checking your eyeglass prescription. I'm going to give you a couple lenses. You're going to tell me which lens is better. So we're just going to see if your prescription has changed at all since the last time you were here. All right, we're going to start off with kind of a lower prescription here. So we have this, okay? So can you see any different with this lens? Okay, it's like about the same. Gotcha. All right, let me just go and check this one, okay? Then we'll do this lens. All right, so lens 1 or lens 2. So 1 or 2. 1 or 2. Lens 1. Okay. So now let's do lens 1 or 2. 1 or 2. 1 again. Okay. Now lens 1 or lens 2. Lens 1 or lens 2. Okay. Let's see here. Lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Just wanna check. Okay. I'm just gonna cover one of your eyes here. Okay. How does that look on the side? Any different? Kind of blurry. Okay. What about with this lens? Is this any better? It's a little better. Okay, how about with this one? Okay, good. Let's try this other eye. Okay, how's this lens? Okay. I'll try this one. Okay. Let's try this one. Okay. Gotcha. Just wanted to see if there was any difference between the two eyes before we continue. We're gonna try this one, and we're gonna try this one. Okay. Lens 1. What does it look like? Very, very blurry. Okay, how about this one? Okay, so this one's also like zoomed in as well. Interesting. Let's see here. How about this one? Yeah, kind of zoomed in. And this one? Interesting. Okay. Okay, so lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Okay, now I'm just going to these two. Okay. Lens 1 or lens 2. 1. Sorry, actually, this is 1 or 2. 1 or 2. Okay. Take a look at these two together. Okay. Okay, what does that do? So it looks a little stretched, right? Okay, and there. Let's see this. So I'm going to take this one. Okay, so one of the zoomed ones. Okay, tell me what happens with this. Okay, interesting. Okay, so what I'm looking at here, just putting this back. If it fits, what the heck? Okay, so what I'm looking at here is this is your prescription. Okay, so it has gotten a little weaker, your eyes, so we had to go a little bit stronger. Not a big deal, happens quite often, especially with me. I wear contacts and glasses. My prescription changes all the time. So now I'm going to measure your face, your PD around your eyes, and we're going to pick out some glasses for you. So we're going to start off with your PD. So I have this tool right here. I just need you to look at my nose, and then we can begin. Okay, just look at my nose, and if this blocks my nose, just try to picture where my nose would be, okay? Just keep looking there. I'm just going to measure. So my nose should be around this area, so just keep looking there. Okay. Okay. So I'm just measuring the distance between your pupils so that when we get the glasses, we can add that number. And it's very important because then you kind of see a little wonky if we get the wrong number. So just keep looking at my nose. You can blink as many times as you need. Okay. Let's see. It's looking like 35. Yeah. So it hasn't changed since last year. It doesn't necessarily change all that much. That's good that we're able to get that. Now I'm going to measure your eyes here. Okay, just keep looking straight at me. Try not to move. Okay. Now we're going to measure one more time with this tool. Perfect. Okay. Now, since we were able to do that, I do have some glasses that are ready with the same prescription, same PD, all of that. So you just need to try them on. So first off, we have these here. Let me just clean the lens quickly. So these kind of give that like Ray-Ban feel. This is what they look like. Just black. They have like two little dots right here. So let's just put them on you. Okay. So how's that? Okay, yeah. They look really nice. Take them off now. So we have these. They're like a pinkish purple with gold right here. And yeah, they're really cute. A little bit different. This is a lot thinner. And they have kind of like a cat eye at the end, just a little bit. So let's try them on you. Okay. What do you think? Yeah, they're really cute. Yeah, I really like them too. Do they fit well? Okay. All right, let's just take those off. Good. Okay, we have 2 more for you. So, actually, we have 3 more. So this one's kind of unique. This is one of our newer ones. It has this little silver half circle at the nose, and it's really pretty thick right here, a little bit thicker than the last pair we had. So it's kind of giving the vibe of the first one, just a little different right here. So let's try these on you. What are you thinking? I honestly think they look really good. Very unique, very different style than the rest of them, especially with that little circle there, half circle there. Yeah, they're really cute. Let's take them off you. Good. Okay. Now, this one is a bit different than the rest. So let me just clean the lens for you quickly. So these are a really pretty, like rose gold, very thin around here, but I think that's pretty much the style that they're going for. Even though they're thin, they're pretty sturdy. These are really, really cute. Over here, they have a little bit of like a plastic cover, so that's not like irritating your ears when you have them on. Yeah, let's put them on you. What do you think of these? Yeah, they're super unique. They're really beautiful. I think they're really cute. I love that rose gold pinkish color. I think they're adorable. Yeah. Do they fit good? Okay. Nice. Okay, so we have one more pair. So these ones might be my favorite. So they're honestly like pretty thick, and they honestly look really nice. I have this pair at home. They also have those 2 little dots here, just like those first glasses we tried on. But these, I don't know, I really like how thick they are here. They give, they're really like sturdy, thick right here as well. So, yeah, these are from Diff Eyewear, it says. They're Weston BK6762. Yeah, they're really, really cute. So let's just try them on you. Okay, very good. All right, what are you thinking? Yeah, for the bigger glasses, it's kind of nice because it fills up like the whole area, so you're not getting like half of your eyesight cut off. Like sometimes I have trouble with glasses that are a little smaller. Yeah, they're really cute on you. You look amazing with those. All right, let's take these off. Perfect. Okay. Yeah, those are the glasses that we have available in your prescription, in your PD measurements, all of that. So you could go home with these, or you can just wait and look at different styles and we can put in an order for you. Okay, so yeah, they were all very, very nice, and I can see why you're having trouble picking one. Which one do I think you should get? Honestly, I think the last one was definitely your style. These are really, really cute. I think these are the ones for you. Yeah, you could definitely take them home today. They're ready. They are perfect fit for you. Perfect prescription as well. So you can go ahead and go home with these today. Okay, so that's what you want to do? All right, yeah, definitely we can do that for sure. And thankfully your insurance covers it 100%, so we won't need a payment for you today. Yeah, so today we're going to be sending you home with your prescription, your updated one, just like a form. So if you want to shop around and get glasses online, you can do that as well. And I think that is about it. There were no issues with your eyes. You looked really, really good. Not concerned about anything. And we will be sending you home with the glasses. All right? Yes. But it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right? Okay, I'll see you next year. Okay, bye-bye. Hi there. Today I'm going to be giving you a super thorough hearing test. So I'm just going to start off by putting my gloves, and I'm going to be also looking inside your ears in the beginning, and then we'll move on to the hearing test. So there's going to be a lot of different beeps, tuning fork sounds, all of that. So let's just begin by getting your temperature and making sure that you're not sick, okay? So I'm just going to put this temperature gun on your forehead. So stay still for me. Good. All right, good temperature. We're gonna do one more, but this one actually goes in your ear. Just want to make sure that we're very accurate. So I'm just gonna put this one in your ear as well. Good. All right, good temperature here. Let me just check your other ear, okay? All right, good. Your temperature is great. Nothing to be worried about there. Now I'm going to look inside your ear with this otoscope. So I'm going to see if there's anything going on in there, if there's any wax buildup, any redness, irritation, anything like that. We're gonna make sure to see this before we get started to really test your hearing, make sure it's as accurate as possible, okay? All right, so I'm just gonna start by putting the otoscope in that ear. Just stay still for me. If you feel any pain, just let me know. We'll stop right away. Okay. All right, so just stay still. I'm gonna be looking inside this ear. Okay, very good. I didn't see any wax buildup or any irritation there. So let's make sure it's like that in the other ear. So I'm going to be looking at this ear now. Just stay still for me. Like I said, any pain at all, let me know, okay? All right, let's do this ear right here. Perfect. No wax buildup there either. So we are just going to look at the outer ear now. Okay. Let me know if you feel any pain sensitivity. Making sure there's no lumps or bumps. It's an issue. Did you feel any pain when I did any of that? Okay, good. Alright, I have this hammer. I'm just going to test the sensitivity of your ears. I'm going to just tap your ears. Let me know if you feel uncomfortable or pain. Any pain there? Okay, let's do the other ear. All right. Good. Now we're going to do the same thing, but with this hammer instead. It's a little different kind of pressure. Let's just stay still. We're going to do the other ear again. Okay, how's that? Very good. Let's do the other ear. Very good. Okay, so no pain there. Now I'm just going to do a small hearing test before we get into the very in-depth one. So this one, I have this little remote here, and it makes that sound. So I want you to tell me when you hear that sound, okay? Very good. Now I want you to tell me how many times you hear that sound, okay? Okay, so how many times do you hear it? Fantastic. Okay. I have a tuning fork, and I want you to tell me when you hear the sound stop. All right, let's begin. Very good. Okay, you got those all correct. We're going to do one more. So I have this tool here and it makes that sound. I want you to tell me when you hear that little beep, okay? Good. Perfect. All right, now we are ready for our extremely detailed and thorough hearing test. So I have these headphones for you. Just get them. I have these headphones for you, and they're gonna go over your ears, and there's gonna be a bunch of different beat tests and stuff like that. So I'm gonna give you instructions for each test, and I'm gonna be writing down some notes during it. So if you have any questions, you can stop me at any time. But we are gonna put these headphones on your ears, so just relax for me. Let me know if they're too tight or too loose, but we're gonna try to make sure that they're a perfect fit, okay? All right, so let's begin by putting these headphones on. So how do they feel? They fit? Alright, now let me just start by putting on the test. Like I said, there's going to be a bunch of different questions for you, and I'll tell you before each test starts, okay? Alright, so the first test is how many times do you hear the sound? Okay, let's begin. Very good. Now when does the sound stop? Very good. Very good. Good. Okay, raise your hand when you hear the click sound. How many times do you hear the click? Which ear do you hear the sound? do hear, but be very careful because they're groups, so it might be tricky. Tell me when you hear the higher pitched beep. How many clicks do you hear? Tell me when you hear the higher pitched beep. Tell me when you hear the beep. What ear do you hear the beep? we are all done with your hearing test now. Let me just write down the rest of my notes. Now let's take off your headphones. So, based off everything that I observed, everything I examined, your hearing is perfect. I'm not worried about anything. You did miss a couple questions, but you know, you can't be 100% all the time. Sometimes sounds are very, very quiet, and sometimes they just sound a little weird. So I think you did fantastic. Nothing to be worried about at all. Your ears looked really, really good. Even when we did the otoscope test, the sensitivity test as well. But yeah, nothing to be worried about at all. That was the end of our exam today. It was very, very lovely to meet you, and I hope you have a lovely rest of your evening, okay? All right, I'll see you around.